Assalamu alaikum and hi everyone. I'm Asrul Arifin Abu Hassan, your lecturer for this subject, Medical Sciences for DMHS program. Today, I would like to discuss about the general clinical presentation of cardiovascular disease. This is our learning outcome for this topic. To define various terminologies related to clinical presentations of cardiovascular disorders, and you can explain the clinical presentations of cardiovascular disorders. Okay guys, now we go to closely lie about this topic to discuss together. Cardiovascular disorders, diseases, CVDs, are the leading cause of death globally. About 17.9 million people died due to CVDs in 2019, equals to 32% of global deaths. From that, 85% are caused by heart attack and stroke, mostly occurred in low and middle income countries. Cardiovascular disorders, diseases, CVDs, are a group of disorders affecting the structure and functions of heart and blood vessels. They include coronary heart diseases, peripheral arterial diseases, congenital heart diseases, cerebrovascular diseases, rheumatic heart diseases, thrombosis and embolism, arrhythmias. This is a common clinical presentations. CVDs, dyspnea, chest pain, discomfort, palpitation, dizziness or fainted fatigue, nausea and vomiting, pallor or cyanosis, sweating, nail clubbing, peripheral edema, distended neck vein, increased jugular venous pressure, JVP. Now we discuss the clinical presentation CVD. Dyspnea is a condition where a person has difficulty in breathing or feels shortness of breath, SOB. It usually happens because the body has low oxygen or high carbon dioxide. Dyspnea can be acute, hours to days, or chronic, weeks or recurrent. Common causes include ischemic heart diseases, IHD, heart failure, inflammation of the heart, such as myocarditis, pericarditis, and endocarditis. Okay, next. What is the orthopnea? Okay, orthopnea is difficulty in breathing that develops when a patient is lying. Supine suggests the left ventricular failure, and severe dyspnea that wakes the patient from sleep, that forced to get up gasping for breath. Sudden failure of left ventricular output, and severe dyspnea that wakes the patient from sleep, that forced to get up gasping for breath. Sudden failure of left ventricular output. Characteristics of chest pain discomfort. We ask using OPQRST. What is that O for onset, when the pain starts? Next is P for provoking and relieving factors, on exertion or at rest, relieved by rest or medication. Okay, next is Q for quality, sensation, venous feeling of pain, heavy, tightness, burning, throbbing. Okay, next is R for radiation, radiating pain to the arm, neck, jaw, and back, and then UNED to assess S for severity. Pain score, 1 to 10, and the last one is T for time. Duration, continuous or intermittent. Palpation. What is the palpation? Palpation is one of the clinical presentation of heart problem. Palpitation means unexpected awareness of the heartbeat. Ask patient whether palpitation slow or fast, regular or irregular, and how long they last. Sudden or gradual onset and offset, usually due to arrhythmia or heart failure. The is fainted or syncope attack. This is also clinical presentation happened to heart problem. So what is fainted madness? Loss of consciousness and characterized by rapid onset, short duration, and spontaneous recovery. Due to cerebral hypoperfusion, low blood flow to the brain, that most often result from hypotension, e.g., heart block, shock, heat stroke, postural hypotension, hypoglycemia. Next clinical presentation, a heart problem is fatigue symptoms that occur as a result of lack of cardiac output or lack of blood supply to skeletal muscle. Usually due heart failure, congenital heart disease, anemia fatigue is a common symptom in cardiovascular disease where the patient feels extreme tiredness, even with normal daily activities due to poor heart pumping. Common early symptoms in many cardiac conditions. Patient complains of easily tired, even with simple activity, caused by low cardiac output and low tissue oxygen delivery. Sign of chronic cardiovascular disease, especially in elderly. Next clinical presentation. A heart problem is peripheral edema. What is that accumulation of fluid in the spaces between the cells due to excess fluid draining from interference by the cardiovascular system and the lymphatic wait. Peripheral edema is swelling of the legs, ankles, feet, or sometimes hands, caused by fluid collecting in the tissues outside the blood vessels. Associated with heart and renal diseases. Bilateral pedal edema, pitting edema, congestive heart failure, especially right heart failure. Severe hypertension, pulmonary hypertension, valvular heart disease. Next clinical presentation. A heart problem is peripheral edema. What is that cyanosis? What is cyanosis? Bluish discoloration of the skin due to lack of oxygen supply to the tissue, especially at lips, central cyanosis, and fingers. Peripheral cyanosis. Central cyanosis is due to low oxygen saturation in arterial blood, lungs, heart problem, at tongue and lips blue, and peripheral cyanosis due to poor circulation, poor perfusion at fingers and toes. Blue. Associated with heart and respiratory diseases. Example heart disease, congenital heart diseases, acute bronchial asthma, pulmonary edema, thalassemia, and anemia. Next clinical presentation. A heart problem is pale. What is that pale or pallor? What is pallor? The lack of oxygen-saturated hemoglobin and abnormal pale color of the skin, and mucous membranes caused by reduced blood flow or reduced hemoglobin level. Pallor is paleness of the skin. Conjunctiva, caused by poor circulation or low HB, which reduces oxygen delivery to the tissues. Decreased cardiac output, and then less blood to skin vasoconstriction. And then body tries to maintain blood flow to vital organs. Chronic heart failure patients often have anemia and then more pale. Next clinical presentation. A heart problem is nail clubbing. What is that nail clubbing? What is nail clubbing? Interruption of oxygen supply to the soft tissues of the finger. Nail clubbing is a condition where the fingers become enlarged and the nails curve downward because of chronic low oxygen level in the body. As a mechanism to cope with the lack of oxygen supply to the finger. Chronic heart conditions that reduce oxygen for a long time stimulate connective tissue growth around the nail bed. Clubbing, such as CCF, congenital heart disease, thalassemia, COPD, chronic PTB, and chronic bronchial asthma. Thank you guys for joining this discussion on clinical presentation of cardiovascular disease. Remember, practice makes perfect. Apply these strategies in your self-study. Thank you.